Dr. Thanks for joining us today.
Thanks for
We
having
really
me.
appreciate having you here. We'd like to get this insight on what things are like here for you in the trauma unit. How hard is it for you to tell a family that their son or daughter or their husband or wife was just killed?
Well, again, I think it's important to emphasize that it's not a matter of how hard it is for me. You're taking a situation which is, for most of our patients are young and were relatively healthy, so they were fine. And it's not unusual for us to hear that someone was talking to them half an hour before and they were fine, and now they're not here anymore. So it's not so much that it's hard for us, it's the worst 5 or 10 minutes of these people's lives that we're involved in. And it's a ripple effect. So whoever was the actual victim was the son, daughter, husband, wife, aunt, uncle of someone else, and that person is a relative of someone else. So it affects not just that individual, it's that individual's family, that individual's community. And then there's the ripple effect of the larger community. So now you have children who hear about this because they go to school with the, again, son, daughter, or whatever of the person who was killed, and they're wondering, is this something that can happen to me? So you now have children who are afraid. You have mothers who are afraid, so it's not just a question, it's definitely not a question of how hard it is for us. That's not the question at all. The question is what is happening to these individuals and what's happening to the family group, to the community. And the other thing I think that's important for people to remember is that, as tragic as it is for people to die from gunshot wounds, there is a whole other large tragedy of the people who survive and who are permanently changed, both from an emotional standpoint, but also from a physical standpoint. We have people, now that we have better technology and we have better medical care, that we save people who we used to we couldn't save. So you've got people who are alive who have huge open wounds, who can't eat for a year. So try to imagine not being able to eat for a year. Or you have people who get shot in their spine who will never walk again, or will never be able to breathe on their own again. So that's actually the larger group of people. And I think from a public health standpoint, as tragic and as horrible as the deaths are, and we absolutely need to be outraged about the deaths, we need to also remember that the larger group of people is a group of people who survive but are incapacitated. When you look at something from a public health standpoint, if you had a disease that was spread by an insect, even if the larger problem was, poor sanitation or something else, even if the larger problem was something else, you would still look at the insect as a vector.
Mm-hmm.
So if you have people who are dying as a result of being shot,
Mm-hmm.
or people who are being catastrophically injured as a result of being shot,
Mm-hmm.
yes, focus on the root causes, and absolutely, what are the things that cause people to want to shoot someone else? We
Mm-hmm.
absolutely have to focus on those things. But you've got to focus on the guns as well. The guns are the vector.